Hi, my name is Nina Kalunga. This is for 3600 exercise, physical activity, and aging. This is my exercise project, exercise prescription project. So a little bit about my client. Her name is Maria. I did this, my client is my mother. She's 73 years old. She weighs in at 77 kilograms, 167 centimeters tall. Her BMI is calculated at a 28.3, which is overweight. I believe 30 is obese, so she's right on the cusp. So her activity level, her current activity status is that she is active. She does light to moderate activity most days of the week. Um, and according to the ACSM algorithm, I decided that it shows that Maria would need medical clearance. She does not participate in regular exercise structured program, and then she does show signs and symptoms of a CVD and CMR disease. So she would start off at a light to moderate exercise intensity, and her progress would be very conservative and as tolerated. And we'll go into that as we go along. So here is her pre-participation and health screenings. I also have an informed consent for her that she completed. So her PAR-Q was not cleared, and it does show that she does have at least two CVD risks present, and she suffers from hypertension. She has arthritis symptoms, and she does have past musculoskeletal issues that she deals with on a daily basis. I also included her fracs here in the middle there, her 10-year probability of fracture. So she does have uh, major, she's very much at risk. And also you can see on her health screening, she suffers from ankle swelling, which could be, CVD, heart disease, symptoms and signs. So again, she would need medical clearance. So these were the fitness assessments that I performed on Maria. So we assessed her lower body strength, her cardiovascular endurance, and some motor agility balance exercises. So I did 2 trials of each. The chair stand is where they sit and stand, a full sit, a full stand, and a 30-second period, as many repetitions as possible. Her average was about 8, would put her a little bit below average for her age group. The 2-minute step was, I believe, in under 2 minutes. She was measured from the top of her suprailiac to the mid-thigh area, and she would do a sort of high knee raises, stepping in place for 2 minutes. And that I measured her right leg only, which still put her at a 37.5 average score, average category. The 8-foot up and go is where I would measure from a seated position, a seated chair, up against the wall, 8 feet in front of her. It was about a cone or a marker, and in the certain time frame, the clock would go, and she would stand up and pretty much as fast as she could circle the cone and come back to a sitting position. She finished off with a 7.6-second average, which put her below average. So this is a generalized slide. So this is what I put in as her factors for, this kind of helped me develop her exercise prescription. These are the FIT principles according to ACSM recommendations for older adults, individuals with hypertension, and individuals suffering from arthritis. So I wanted to get an average of each recommendation guideline, and so that I can formulate her prescription that would benefit her the most as far as getting the most out of her aerobic, her resistance, and her flexibility. So as you can see below as well, I also included these scales. So light is 30 to 39%, moderate is 40 to 59%, and vigorous goes up to 60% to 89% of their VO2 max rate. So the intensity that we use as well is measured on the Borg scale from 0 to 10, 5 to 6 being moderate, 7 to 8 being vigorous. And we also use the RPE scale, I believe is from 6 to 20. And that goes for while they're doing their exercising, how they're rating their perceived exertion. So you also want to use that. And then the Borg scale is also used for um, um, pain. So especially dealing with individuals with arthritis, you really want to watch out for their pain factor and get into consideration when they exercise, um, uh, and not push the envelope with them, pretty much not push them too hard, as they could suffer from a lot of pain from their arthritis. And you want this to be something somewhat of pain-free, and it will be uncomfortable, but mostly we don't want to push them too far. So for Maria's 16-week prescription, I put those into 2 phases. So the first 8 weeks, she would be doing light intensity, getting used to like the functional movement, which she's not used to doing, like free weights, resistance bands. She's very, very novice, even though she's active. She's never done a structured program before. And then in going into phase 2, she would try to, I pushed her, according to her plan, into a moderate intensity. Both of these phases would include a warm-up and cool-down, and the flexibility and balance exercises would be performed daily for her. So her warm-up and cool-down prescription is pretty simple. For warm-up, at least 10 minutes. She would be doing hip circles, 20 circles each leg, and the progress would be into bigger circles. So I put a little pictures there so they can see what the kind of exercises I'm speaking of. High stepping, assisted knee to chest 5 times per leg, and then progressive stepping out. And obviously, because of Maria's balance issues that she might have, assisted knee to chest, hanging onto a counter or chair is always recommended. The cool down is about a little bit longer, so it's about 15, recommended 15, at least 20 minutes to cool down. She'd be doing a side stretch here, and I can't move my little face here, but the calf stretches are up against the wall, the knee bent, heel down, and you straighten your back leg for about 15-second hold. Pretty simple. So this is her cardiovascular aerobic prescription. So I put her in the first phase, I put her about 3 times a week at a light intensity, 50 minutes or 10 minutes of 10-minute sessions throughout the day. So I just put stationary cycling and walking, because again, I wanted to be careful about the type of exercise I was giving her. Again, she does have some lower body musculoskeletal issues. So again, light work, as best as she can do it, as tolerated. The volume would be 150 minutes a week, which is what we want her to start at. And then she could progress up to at least 60 minutes, or, add in another day of aerobic exercise. Again, and there's a note down there, she does have a heart rate watch. She always measures her blood pressure through like a home system that she uses. And then she's also medicated, so it is somewhat controlled. But again, with older adults, we see a rise in their blood pressure as they exercise and at rest. So phase 2, we did a 4 times a week, moderate intensity. And again, the details are there. She's going to be doing at least 200 minutes a week for that. Her resistance is through phase 1 and phase 2 stays steady at 2 times a week. She'll start off at light and progress into moderate. She's going to be able to be doing, she'll be doing functional body weight exercises, so a lot of body squats, and functional movements for her ADLs. So I put as tolerated because, again, this is something that's very new for her, and her dealing with arthritis and musculoskeletal issues. She will need, she'll need time to adjust, and as pain permits her to participate in the exercise sessions. Her flexibility will be done daily. Tightness to slight discomfort. She'll start off with 10 to 30 seconds for each muscle group: active, passive stretches, static stretches, dynamic stretches, PNF stretches. The first exercise would be a supine hamstring stretch with the toe flex, and then a band pull apart. She'll progress into the second phase for 60 seconds each muscle group, and then she could also up the band resistance. So they have like 3 different resistance bands. They come in a pack, and it's like light, moderate, or heavy resistance. Depending on how she feels, she can move up in there and then also increase her sets to progress. This is an example of those exercises. So a supine hamstring stretch is very low impact, and she can pull and stretch as her pain permits her to. And then the band pull apart is just an upper body strength stretch, stretching the shoulder blades, putting strength into the arms, the chest, and just giving her a full upper body type of stretch that she needs. The balance mobility prescription is described very similar. She would do one-legged stands, and then I also implemented Tai Chi. I am a staunch believer in Tai Chi. I perform Tai Chi every morning. And so she would progress to like tandem stances, a little bit more, maybe 30-minute or 40-minute sessions of Tai Chi, and it's also very good for stress and hypertension. And then phase 2, she would incorporate dancing. She likes to dance, so I wanted to incorporate also activities that she enjoys. And she always blasts her music early in the morning, so she would really love that. And so I wanted to incorporate something that would still keep her moving and something that she would enjoy and adhere to. So this is some examples of the one-legged stance to help her with her balance issues. Those can also be assisted. And then assisted heel and toe raises is what she'd be doing in the second phase. And then Tai Chi practice, she's probably combing the lion's mane or the horse's mane here, which is a very popular movement in Tai Chi. So this is something that she would start to learn and practice, and it would really help her, her overall health. So some contraindications and considerations. Again, for Maria, she is hypertensive, she's medicated. She has arthritis, which is low to moderate pain factor, she told me, low to moderate pain tolerance. Her musculoskeletal issues, she both has upper and lower. So I had to be very careful about the types of exercises she was doing. So very low impact, stationary bike, and on days that she feels better, she could go for a walk. So considering for older adults, hypertension, resting and exercise BP is typically higher, so we'd have to really watch her blood pressure. Reaction time is slower, her recovery time is longer, which is why her cool downs are longer. And then incorporating behavioral strategies will always help. Regular feedback, positive enforcement, especially as they get older. They have a lot of safety concerns. And then her progression is very individualized and conservative, and I kind of wanted to address her goals and as pain is tolerated for her. A sample day would be she would wake up, she could do a morning session warm up, straight out of bed stretching, even noticed here in the picture, she can do those arm stretches with the resistance band straight out of bed. She can start a Tai Chi session even with me, and she can go for, she has a little more time in the morning. She can go for about 20-minute walk around the neighborhood and then have a nice cool down. In the afternoon, she can do again another warm up, about 15 minutes of resistance work. She could do very low impact, and then she could do her flexibility exercises and her cool down, and then her regular routine of either working or housework, whatever she likes to do. She's retired, so she has time to do that. By the evening, again, she could do a quick little warm up after dinner. She can do her little 15-minute walk and then close the day off with a Tai Chi and balance session, and then do a nice long cool down that would help her relax in the evening. These were my references. So again, I referenced on arthritis.org, ACSM guideline for exercise testing and prescription. And then I did look up some pain, shoulder pain exercises that would help with that. And that's my presentation. Thank you.